today's agenda, we're going to do some introductions. So we'll talk a little bit about our background, and then we'd like to hear a little bit from you. And then we will go into the orientation for the rating process and what that entails. And then what actually happens during the orientation or the rating window, and then what to expect when you're actually in that observation window and your raters are coming out to observe your classroom, and the documentation that you need and those items. And then we'll talk about what happens after all of those things take place and the information that you get back, which is the quality performance profile. And then we're going to finish up talking about strategies for working through the process as a team. So introductions, tell you a little bit about myself. My name's Connie, as I said, and I've been with Qualistar for a little over 3 years now. When I very first started out in early childhood, I went to Front Range Community College, and I attended a program to become infant nursery supervisor qualified. So I worked in a lot of infant and toddler programs, and then I worked in 3-year-old, 4-year-old, preschool, school-age programs in a lot of different settings, some corporate centers, some nonprofit, Weld County School District. So I've had a lot of different roles in the classroom. I was also an educational coordinator, an assistant director, and then a center director for several years. So that's my background.
Like I mentioned, my name is Liliana Flores Amaro. I've been with Qualistar for about 2 years now. Prior to that, I have spent a lot of time in the classroom working with a program called Ambassadors for Literacy that takes middle school and high school age youth and brings them back into the early childhood classroom and work on strategies to increase literacy in the classroom. So that's what I was doing after school and during the summers during middle school and high school. So, and it sounds like we have a wide variety of backgrounds, not only, interests, but also geographically. So I think that's going to help us have some really good conversations today. So for those of you who might not know, the mission of Qualistar is to advance quality earlyhood child education around the state of Colorado. We do this a few different ways. So we have 3 different but interrelated programs, and one that most people are familiar with is the Qualistar Rating, which we'll be talking in a little bit more detail today. We're also the state partner for the Child Care Research and Referral Program. And then we also help programs around the state through our professional development and quality improvement department. So like I mentioned, today is going to be mostly about the Qualistar Rating. So if you have any other questions about resource and referral or any sort of other quality improvement workshops or trainings and things that are going on in that side of Qualistar, you're more than welcome to visit our website or call our toll-free number. And then Connie's going to talk a little bit about the Qualistar rating process overall.
All right, so the reason for the Qualistar rating is to assess the quality of child care in early childhood programs. And this can be a variety of settings. It might be a home facility that you have, or it could be in early childhood, it could be in a school setting. So there are many, many different programs that we see, and we can work with all of those to assess their quality. The Qualistar rating is a voluntary process, and most ratings occur on a 2-year basis. So unless the program is maybe involved in school readiness, and then those tend to occur every year over a 3-year period. There are different rating levels, and those look like star levels. So as programs go through the process, they are given points for the different components of the rating, and then those relate to star levels. So we'll talk more about that and how those components fall into that. The Qualistar rating will outline the program's strengths and then any areas for improvement. And at the end of the rating process, it will provide you with a detailed timeline so that you have some information to continue to work on your quality improvement process. And the Qualistar rating is also research-based and patented. So benefits of the rating, there's some of them here. It is easier for rated programs to access some of the different grants and funds that are available in different areas. And rated programs give parents an opportunity to look at different programs across the board and see where that quality lies and find out those areas that are important to them, how that program is invested in the quality in that particular area. It also helps you to, again, assess the needs or the quality in your ECE program, and it provides you with that quality improvement plan so that you can do more planning. Yeah, that's it. We did do some research with providers and coaches, and these are some of the different components of the rating and how those people felt those components were most valuable to them. So we had them rate them. So the learning environment pretty consistently is important for both providers and coaches, and then they're just numbered according to that. So quality improvement, obviously, family partnerships are a large piece of the rating, and then we do look at training and education, ratios, and some of those components, and accreditation as well.
Can you define family partnerships?
Yeah, so we're going to go a little bit more detail further on, but basically what we're looking at, okay, so just really how you interact with families and communities.
And there are two different components of that, so we'll touch on each of those and let you know what those look like. Before you schedule your rating, there are some important things to consider. It is always good to look at staff turnover, because as anybody who works in early childhood, you probably know that when you have consistent staff, it's much easier to have that consistent quality across your program. So look for less than 40% staff turnover in the previous year. And then also administration. If the administration is stable, that also makes it easier. Definitely doesn't preclude you from going through a rating if the person is really invested in that process and in assessing their quality program. But it can make it easier because they've already built those relationships with the staff and the families, and so that can make the process easier. What happens sometimes is programs either open a new facility or maybe they have to change locations. So it's important to assess how long you're going to be at your particular facility, or if you've just moved in, you want to give some time for everybody to adjust to that process. And then if you have any licensing violations that you need to address, it's best to address those before you begin the QRIS system, because you'll probably find those cropping up again in some of the indicators as you're going through your rating.
All right, and then now I'm going to talk about the different components of the rating. And so the first one is the learning environment. And what we're looking at or looking for in a learning environment is we're really looking at the space that's provided for the children, the routines that the children are being engaged in, the language and reasoning and interactions that staff are providing for the children, as well as the activities and materials that they're able to access in the different areas, as well as the overall program structure. In order for us to evaluate the learning environment, we use 3 tools, and those are the ITERS, this is the blue book, the Infant Toddler Environment Rating Scale, and those are used for children up to 30 months of age. So if any of you have rooms where there may be the transitional rooms, if the majority of children are under 30 months of age, we will use the ITERS tool. If you have any, the majority of children that are over 30 months of age or 2.5, then we'll use the ECHRS tool, which is the yellow book, the yellow spiral. So the ECHRS is for children 2.5 through 5. And then the FICRS tool is used for family child care programs. The family partnerships component of the rating measures the collaboration and communication that the program has with its families and the surrounding community. We're also looking for the different ways that families can be involved in the program. We measure this through two different ways. One is the questionnaire that families get that they're able to fill out, confidentially, of course. And then we will sit down with the program and go through a checklist that kind of correlates with what's on the questionnaire, and just trying to see both sides of what the parents are experiencing and then what the programs are, what they have documented for their program. Training education is the component where we're looking at the level of experience and education that your staff has. So we're looking for the highest level of formal early childhood education or training that your staff have. We're looking at it both for staff and for administrators. The adult to child ratios and group size component is we're looking for sort of the ideal, optimal, certain number of kids per certain number of adults. The group size looks at really an optimal overall group size. So while 50 kids and 7 teachers on the playground might give you an okay ratio, the group size of 50 kids is not optimal in our eyes. So that's how sort of different ways that we score both ratios and group size. And then for each of the components, so both family partnerships, training and education, learning environment, ratios and group size, you can earn up to a maximum of 10 points per component. So you can get 8 total points for ratios and then 2 total points for group size, which totals 10. And then accreditation is the last component of the rating that we look for. And so we just recognize programs with an additional 2 points if they are accredited by any of these agencies that are listed on the screen. As I mentioned before, each component gives you sort of these raw points that you get. Those then are calculated to get you a star rating. So anything between 0 and 9 points, or a 0 in the learning environment, gives you a provisional rating. Anything between 10 and 17 points gets you a 1 star. Anything between 19 and 26 points gets you a 3 stars. And then if you get anywhere between 34 and 42 points, you will have earned a 4-star rating. All right. And then Connie's going to take you through the Qualistar rating process, which some of you are interested in because I think you're kind of moving towards your next re-rating or initial rating.
So whether you've been through the rating before or if you're just new to it, there are several steps that we're going to follow. So the first one is going to be contacting Qualistar to set up your rating. So when you call, you can talk to Tina Fetzer, who is our lead quality rating specialist, provider support. So she's your support person, and she can answer any questions that you have about getting set up for that rating process. And then after you talk to Tina, she'll talk to you a little bit about what month you're interested in maybe doing your rating, what kinds of openings we have. There are some months that are very busy, maybe difficult to get into those. We want to think a little bit in your programs about what's happening. Is the summer rating good for you, or does your program close or completely change? In May, does your program close early because it's in a school setting and it might not give you the full month to go through your rating? So you want to think about some of those things, and those are things that you can discuss with Tina. But once you talk to Tina and you talk about the month and all of those little indicators, then you're going to receive an electronic application, and your electronic application is going to include several sections. The 4 sections that are first, which is the application, and then there's a section on classroom information, so you fill out information about each classroom's operating hours, the number of children, their ages, the staff that work there. You'll fill that section out, and then there's a staff section where you'll indicate to us the staff members that work at your facility along with the administrators. If you're a family care home, then you'll talk to us about the providers that are in your home. Sometimes it's just you, and sometimes you may have helpers. And You'll fill out information about how much training and education they've had, how long they've worked in early childhood, those kinds of things. And then there's a getting ready for ratings section that will walk you through some of the other steps. So all 4 of these are mandatory, and you have to complete these before you can send your information back to us. And then there are some components that are optional, but they're recommended for you to finish, as they'll help you get ready for other steps of the rating process. So one of those is, and I have to look up the name because it's got a crazy name. And I can never remember the whole thing. Yeah, it's the documentation.
So,
do you remember it?
Family Partnerships Documentation Checklist, that one? Or
Yes, but it's something else when they see it, so
Oh.
I had marked that down so that they would know what it
Worksheet.
was. And now I can't remember what it is. But yes, it is a document that you can fill out that goes along with the data that we will collect from you in step 3. And it helps you to gather the information that we're looking for. And it is a documentation checklist, and I think on your end it's called an assessment documentation
worksheet or
checklist or
something,
worksheet.
yeah.
But it has the same thing. It has 9 questions, and it asks you to provide us with examples of how you meet those components for your families. So for instance, the first one asks you about your enrollment packet and information that parents have to fill out to get started. And in that section, we would be looking for your philosophy and that you are providing families with your policies and your procedures. So that's pretty easy to pull together. A lot of people like to use a 3-ring binder or maybe a file folder and just pull that information together in one section. So you can use that document or not, but it's very helpful when you're trying to get ready for the next step of the process. The other pieces that are optional are there's a training and education worksheet that is similar to what we will fill out when we collect your documentation. And this is helpful for you as you're pulling that documentation together to kind of assess what score you might be looking at and help you know where you stand in that particular component of the rating. And the last one is a self-assessment. If it's the first time for your program, it's highly recommended that you go through that. And that's a really good piece to do along with your staff to kind of assess your program and what your philosophy is. And we'll talk about that in the 3rd section. A quality rating specialist, let's see, I guess what I want to say before that is when you finish filling these pieces out, before you submit your application, you need to print. So if you can just remember, print before you submit, because once you submit, anything that you want to print is not going to be accessible to you. So these components that I've just talked about that are worksheets for you or documents to aid you in what you're doing, you want to print those, as well as any information that you filled out that you want copies of. Print those before you submit your application. Once you submit your application, then you're going to get a final overview page, and that page is going to give you an access code and allow you to access the online surveys for your families.
And the rater will contact you about on the 15th, so about 15 days before your observation window starts, just to go over some details and make sure that if there's been any updates to any staff or anything like that.
Information can change, so don't worry
Yeah.
about that. So your information has been submitted and your rater has been assigned, and you get the phone call and you discuss any new information, make sure that everything is correct. And then your observation window begins. Your observation window is the whole month of the month that you're scheduled. So if it's March, then it's from the first day of March until the last day of March. So ratings can occur anytime within that window. During that time, the rating specialists, and there may be one for your site, or if you have a large site, there may be more than one who comes out and does different classrooms, then they will conduct all of those observations during your observation window. And they will also need to meet with you to collect any data. So all of the things that we talked about as far as the documentation checklist, Though that information we do not need to take with us, but we will look through copies of it with you and document that data while we're there. Training and education, we do need to take copies of that for your file so that you know that you need to have that ready. So it takes about maybe half an hour or 45 minutes to go through that information with you during your rating window. And then after your rating window ends and all of this documentation has been collected and all of your classroom observations have been finished, then your rating specialist will write a quality improvement plan for you, and the quality performance profile will have all of the classroom reports. I think we have some samples of those that we could pass around if people want to take a look. There's one for family homes and one for centers. Definitely we could pass those around if you want to take a look at what you get. If you are a first year program, then you will get your information in the binder. If you've rated more than 1 year, then you will get your information online and you will print it and replace it in your binder. Let's see, and then after you receive this information, then your rating specialist will contact you and talk to you about a time to complete a consultation, which is when we can get together and go over all that information and answer any questions, clarify any things that you have that you're wondering about.
And then I'm going to talk about what to expect during your rating observation. So classroom observations are unannounced. They last about 3 hours, and then the rater will need about 15 to 20 minutes just for some follow-up questions with the staff. And we like for there to be at least 75% of the children in attendance, and generally a typical day in that particular classroom. So, yes?
Is that morning or afternoon or any time during the day?
It really could be any time during the day. With infants, it's a little bit more flexible because they're kind of any time. We usually try to schedule about those 3 hours before nap time, just so staff can maybe have that time to either have someone come in or we can sit in the classroom and talk quietly afterwards. But it can be any time. And as far as the 75% attendance, if you have 19 kids enrolled in a classroom, but you expect 12 on Wednesdays, then we're going to go by that 12 that you expect on Wednesday when we're there. So, and there are certain days that you can black out if you know you're going on a field trip this day and your kids are not going in a particular other day. You can note those up to a maximum of 5 days that we won't be there. So. When the rater gets to your program, she will check in, and I say she because right now there are no male raters right now. So she will check in at the front or at the check-in desk, and then we'll wash her hands upon entry to the classroom. We'll give sort of a brief overview of what the morning is going to look like, and then we'll also need to know the birth dates as well as if there are any children with identified special needs. So you'll see us kind of pulling out different tools when we're in your classroom. So obviously we'll have the spiral tools that we use. We also will have, let me pull out a score sheet. You'll see us with our score sheets kind of flipping pages and writing down lots of notes as we move around your classroom. And we'll also have different tools like tape measure to measure your mats and the playground, head entrapment tools, what are we calling this? Playground surface measurement tool, and that's what we use to measure the cushioning. We'll also have a thermometer to measure the water temperature at your sinks, as well as a choke tube for chokables.
What's the teal item?
These are what we use to measure head entrapments, and this is a finger entrapment tool.
So if you have
again, with that initial conversation, we're going to ask if we can, as a rater, look through any unlocked rooms, cabinets, cupboards, anywhere that the children might have access to that are unlocked. We'll obviously try to minimize the disruption of your classroom. I know it's kind of hard with some stranger kind of following you around and watching you to see what you're doing, but we try our hardest to, blend into the background and really, not engage children as much. So sometimes kids are really excited to see us, and they're like, who are you? What are you doing? What is that? Come up and give us hugs, and I love you, and we're like, love you too, but go see what go see what Mrs. is doing, or sometimes they'll ask us to tie their shoes, so we'll be like, go ask Miss Amanda for
back to the classroom activities.
Yeah.
But you're welcome to introduce us if
Mhm.
you feel like that helps. And when we're in the classroom, we don't mind at all waving to everybody and saying hello. So if you feel like that is appropriate for your class, then please do that.
Yeah. So like I mentioned, we'll need to go around the entire classroom and look at the different bins and materials that you have around the classroom. We'll also need to watch hand washing routines as well as diapering and toileting routines. And so we do this obviously, respecting and honoring the privacy that the children have. So we'll try to find a good spot that kind of lets us see what's going on while respecting the privacy of the child and the staff member doing it. So. There might be more than one observer in a particular classroom, and so this happens usually two ways. So one is when we have a new rating specialist or a new Qualistar employee. We like for them to see what we do and experience that in an actual classroom setting. The other way that there might be two people in the classroom is if one of us is on a reliability. And a reliability is our own quality control check system, and so it'll be one of the Clayton ERS team members coming out with us to really watch us watch you. And so we have to go through an initial reliability process on the tools, and then we have to go through a re-reliability process. So every 10th or 12th observation we go out with the ERS team. We have to be have at least 85% similar scores with them. So, and for family homes, you might probably see us every time because we only have so many family homes. And then after the observation, the rater will then write an individualized classroom report. The primary rating specialist will then collect and analyze the data from the other components of the rating, and then we'll write the quality performance profile. And then Connie is going to talk about maximizing the QPP.
So the quality performance profile is what you receive after all of the information has been gathered, and it's going to include, as you see in the ones that we're passing around, your learning environment report, your family partnership report, your training and education, adult ratios, and any accreditation information that you've given us. It's going to give you a breakdown of how all of those things are scored. We do have some criteria rating charts here. Probably not enough for everyone. If you would like one, then just let us know and we can definitely send you one of those. But we could pass those around for you to take a look at if you have any questions specifically about the different components and how they're scored. And then we're talking a little bit about teamwork and how this begins. We mentioned earlier when you're doing your self-assessment that one of the ways that you can include your staff and get that buy-in from everyone about the quality that you're looking for is to talk during the assessment process about what your goals are for your program, what your philosophy is, and how everybody sees that translating to quality in the classroom. So that piece, and then just as you work through the process, so you may be working with a coach or you may not be, but you certainly can break down these different components that are in the tools that you're using and maybe focus on learning environment one time, and maybe you'll say, let's talk about activities and how we make that happen, or let's talk about health and safety. So when you're pulling those meetings together, you can talk with the staff and brainstorm about different ways to make those criteria happen and work together as a team throughout this whole process. And so each of these components can be used for that. After you receive all of this information, then it's a good idea to give this information to the staff. It's nice for them to have access to their classroom reports, be able to go through those and ask any questions that they may have or find out any clarifications. then your rating specialist will contact you to set up a time for that consultation. And that is when we can get together and discuss any of those things. You're welcome to invite any of the people from your school, your administration. If you have a coach, you're welcome to invite them. Generally what happens is we meet with those people and they bring questions from the staff members to that. And then after our consultation, then you can filter that information back down to them. And this just allows everybody to take ownership and feel like they're working together as a team with the administration.
Yeah, because I think as a we see when teamwork doesn't go as smoothly, when we're in the classroom and when we follow up with the consultation. And I think it's really key to try and get your program where you want it to be, to have everyone on board and kind of understand, why do we want to be Qualistar rated? Why do we want to be NACE accredited? Why, do we want to implement the class tool? Just to have, your staff kind of thinking about those things, and, maybe there's different ways that your staff see, and different ways that the admin sees, and maybe you can come to some good consensus. But definitely, using the QPP and the QIP, to your advantage. You can use as much of it or as little of it as you want. It breaks it down per classroom, so you can really target the issues that are affecting a particular classroom as well.
And then after you finish this rigorous process, then we want to make sure that you're remembering to celebrate your progress towards quality improvement, because it's a lot of work and you've done a lot to ensure that you're doing the very best things for children in your classroom. So it's easy to focus on those things we need to improve, but we always need to remember to celebrate all those great things that you're doing, and we see so many of them. So this is kind of a model for how the piece works. As far as quality improvement, you want it to be an ongoing process. So getting ready for ratings, having your rating, consulting and making your plan and goal for the coming years, and then implementing that, and then starting that process over with whatever components. So if you decide to continue with the Qualistar rating or adding some of those other tools in, that's a good way to do that.